Hello, I'm Dr. R.D. Khare, pediatrician from Mumbai. Today we will consider some aspects of constipation. Constipation is a very common complaint both in children and adults. We will consider constipation in adults first before we consider it in children. The features of constipation are frequency of stools less than 2 times in a week, hard and pellety stools, straining at the time of passing stool, sensation of a retained stool, and sometimes there is need to support the perineum or digitally remove the content from the anus. After having confirmed that it is a constipation going on for more than 3 months, then we consider constipation as organic to a secondary disease or non-organic. Though non-organic constipation is much the more common, fortunately, we must rule out organic causes first because they may be serious. The indicators for organic causes are a recent onset constipation, constipation with loss of weight, constipation associated with pallor, constipation with bleeding PR, and on PR examination there is an increased anal spasm. These features often may suggest a carcinoma or a stricture or some of the associated disease like avascular problem or inflammatory bowel disease. Hence, having ruled out constipation, other causes, it is important to remember depression, psychological depression, or some drugs taken by the patient can also produce constipation, especially the drugs as antidepressants or some cough syrups or anticholinergic drugs. So it is to be kept in mind. And lastly, metabolic diseases, especially hypothyroidism, in which there is a constipation which is an associated symptom. Having ruled out the secondary causes, then we review how to treat a primary cause. Luckily, the primary constipation responds very well to just simple measures. 1, lot of fluid intake. 2, a good amount of fiber in the diet. And 3, very good exercise. Though easily said, often these are not practiced as well as it is necessary. If there is no relief with this, then causes of secondary constipation can be revisited. Now we come to primary constipation. In primary constipation, children have again decreased frequency of passing stool, painful and hard defecation, and often there may be an act of straining, but more than that, there is evidence of retention of stools. So frequency, hard and painful defecation, and tendency to increase retention of food of stool, especially in the rectum. Having considered a constipation, and if it is going on for a month at least, then we again have the same approach, primary or secondary to organic disease. One of the most important organic disease that we would like to consider first is Hirschsprung disease. Both present as constipation. However, there are quite a few differences. In a neonatal period, constipation in Hirschsprung disease may be associated with delayed passage of meconium, associated with difficulty in feeding, abdominal distension. In general, the points to be which will distinguish Hirschsprung disease from functional constipation are in Hirschsprung disease there is associated nutritional deficiency and therefore decreased weight. These children are often undernourished. Then there is never any history of soiling of the undergarment, and on PR examination the rectum is empty, and when you remove the finger a lot of foul smelling stool comes out. As opposed to that, children with functional constipation are relatively well nourished. They often have a history of soiling of the undergarment, and the rectum is already loaded with hard stools. Hirschsprung's disease having been ruled out, we consider other causes: spinal cord problem, spina bifida occulta, which we seen on careful examination, or there may be abnormality or impaired sensation around the perineum, or anatomical causes such as anteriorly placed anus or anal stenosis. But also important are other causes related to development of the child. For example, children with delayed development, or those who have features of autism, or who are on have other problems related to spasticity of the lower limbs, often may be associated with constipation. So this is another cause of secondary to non-organic. As earlier, it is important to remember that it could be secondary to some drugs like opiates or anticholinergics or barbiturates, and thyroid hypothyroidism can be an important cause presenting as constipation. So having ruled out the causes wherein the constipation can be secondary to organic cause, we come to functional constipation. Very common. Out of all the cases of constipation in children, about 85 to 90% of children have functional constipation. What happens in functional constipation? Due to some experience where the child had painful defecation, may be associated with sometimes even a fissure. The child associates pain with defecation. Such a painful experience in the beginning can be different at different ages. For example, in infancy, it could be something to do with a weaning diet. In a little older toddler child, it can be overzealous toilet training, or it may be in a school child, avoidance of going to toilet in school, or the child is too busy playing. But whatever the cause, initial painful defecation gives the impression to the mind that defecation is painful, so he withholds the stool, and the act of withholding is in the form of tightening of the lower limbs, holding of the buttocks together, walking on the toes, sometimes arching the back, and even sweating. Some parents have described defecation is like an act of labor. Often they go behind the door and hide and then pass stools. This is an initial experience of painful defecation. Therefore, every time there is desire to pass stool, child makes effort to withhold the stool, leading to retention of stools. Retention of stools leading to further hardness of stools, and therefore whenever child passes a stool later after day 2, day 3 also, is always a hard stool and therefore painful, and therefore it reinforces his belief that passing the stool is an ordeal. On examination, as I told you, nutritionally these children are normal. There will be illness will be loaded with hard stool, and often there will be evidence of retention of stools in the rectum, which may be felt on the abdominal palpation as hard fecal masses in the suprapubic region. Associated with that, often these children may have urinary problems in the form of enuresis or recurrent UTI. Having diagnosed a functional constipation in child, the treatment is A. Disimpaction and maintenance treatment, that is giving right to relief to the child. Disimpaction is done by either lactulose or PEG medicine, which is given every day orally in the dose of 1.5 grams per day. Initially, it may have to be given for first 3 to 4 days, and after disimpaction is achieved, then this child is put on maintenance treatment. The disimpaction can also be achieved by giving a phosphate enema from below, but as far as possible, we avoid anal manipulations in a child with habitual constipation. Polyethylene glycol is also known as PEG. Having achieved disimpaction, we treat the child on maintenance dose of 1 gram per kg, 1 gram per day, and it is given every day till the child starts passing soft stool, painless stool every day without any evidence of soiling for quite a few months. and this treatment is continued for anything between 6 months to 24 months. Often the common pitfall is that after having achieved initial good stools and soft stools, often there is a tendency on the part of the doctor or on the part of the parents to stop the medication, thinking that the child will get habituated to that. This leads to frequent recurrences. So if I have to give a message regarding the treatment of functional constipation in children, one sentence I would like to say is, continue the stool softener whichever you give, PEG or lactulose. Continue for a long time even after you have achieved good results with painless and soft stools. Otherwise, it's likely to lead to recurrence. In spite of that, about 20 to 30% children will have recurrence. The other aspects of treatment are good amount of fiber in the diet and toilet training. Though I mentioned overzealous toilet training may be the cause, regularizing toilet after having achieved painless stool, putting the child on a potty seat for 5 to 10 minutes, 2 to 3 times a day, especially after food, may be able to achieve desired toilet stool after a period of few weeks to few months. Needless to say that we will have to rule out hypothyroidism in this particular child, and attention be paid to the fiber in the diet. Most of the time, bottle-fed children drink a lot of milk and they do not consume good amount of food, resulting in poor fiber in the diet. Many bottle-fed children are reasonably well nourished, anemic and often constipated. So this summarizes the management of constipation. To summarize, it should be first confirm constipation by remembering the features of constipation in children and in adults. Rule out organic causes of constipation like cancer, stricture that occur in adults, and age above 40 is also a risk factor. Having ruled out organic causes in children and in adults, to diagnose functional constipation and long-term treatment, relatively simple for adults and with medication in children, is the key to the answer. Thank you. The next presentation in this series will be by Dr. Sridhar Ganpati, and the topic will be what is indigestion.